The importance of data collection in healthcare has grown through the use of advancing digital technology. The University of Aberdeen uses this technology along with their research expertise to take a leading role in the use of big data for public health issues. Helena Carter went to find out more.
At the University of Aberdeen, they're flying the flag for the use of big data in public health. The data collection, analysis and interrogation carried out here influences guidelines, changes healthcare decisions and impacts policymakers and health professionals across the globe. The Aberdeen birth cohort from the 1950s is a key example of how big data is being used to help answer key public health questions.
The Aberdeen children of the 1950s started in the 1950s with people who were born between 1950 and 1956 and were in school, in primary school in Aberdeen. It captured everybody, so there's around about 12,500 of them. And they participated in surveys, in tests at school, integrated into their lives. They barely noticed it happening to them. And we've continued to interact with the participants ever since then. Now, rather than writing to and asking them to gather data, much of the work we do with them is linking to digital records. So linking to their electronic health record, to blood tests, to medication prescriptions, so we can follow how they're getting on in health.
Bill is part of that cohort. Now in his 60s, his pride at being part of such an influential study is clear.
It's a complete privilege. I'm almost slightly emotional about that. I feel that what the NHS and medical research has done for us and my generation in particular, being one of the first generations after the inception of the NHS, means that we've a lifelong indebtedness to carry on working together. Participation in such things is a responsibility and an obligation that's served with gratitude.
The academic teams work hard here to ensure the research they do reflects the needs of the population and ultimately improve the health of the public worldwide.
We get policymakers to sit up, we get health professionals to sit up, we get patients and public interested in what we're doing. We've had discussions with some of those people who were participants, and they have said to me, as they have to other members of the team, "You've changed my life. Your trial has changed my life. Like, I've got a better relationship with my family, and my business is doing better. This has changed my life." And that is what really good research can do. It can change people's lives for the better. It has to be really good. You need the methods to be well constructed, well presented, so that people trust it and believe it.
And there's belief here in Aberdeen that innovative developments in digital technology can be life-changing, particularly for those who find it difficult to get to a GP.
The benefits of digital technology when it comes to health can be seen right here in this new GP app. So tell me a bit about how you hope this is going to influence lives.
For people with cancer pain, it will help them communicate about what's important to them with their healthcare professionals and GPs, and really help professionals and patients to get the most out of that 10-minute consultation. The key things are the ability for the person with cancer pain to track the painkillers that they're using, to do it very quickly, and to be able to communicate it automatically with their general practitioner. A weekly diary that asks them about more subtle things, for example mood and stress levels, as well as pain and activity and function and things that are important to them.
The value of big data when it comes to public health is immeasurable. The work being done at the University of Aberdeen continues to influence decisions and change lives as they look towards a future that prioritises the health of every single one of us.